episode 148, Chicks with MDs Advocacy. I'm your host, Dr. Justin Trustberg, and today we hear Dr. Lisa Whitty Bradley's perspective. During 2017 and 18 Podcast Awards nominated host and best-selling author on Amazon, as we get a behind-the-curtain look at all types of doctor and guest specialties. Let's hear a doctor's perspective. Welcome back. Today is a bittersweet episode because this is the last time I can say live in China because we're moving. We've broke down our house. We got 4 suitcases and some carry-ons. It is stressful, but we knew this going in that it wouldn't be permanent, so we didn't buy a whole bunch of stuff that you can imagine. And then we're going to move to Cologne, Germany in January. So an exciting time. Get to spend the holidays with the family. 2 of them, actually. That's fantastic. 2 holidays. Give you a heads up. The 3rd book is coming out before Thanksgiving. Artwork is getting finished right now. Pretty much, if you want to do business in China, you got to be able to handle the dinners with the round table and the drinking and the losing face, gaining face. And so I'm going to walk you through how to do that so you can gain face, not lose face, and not look silly and know the nuances and really impress your clientele. So that will be available on Amazon and the webpage. And then the relationship book, that's not going to be until late 2020. I mean, I got stage 1 done compiling, but mixing it all up and editing it and all that, bridging the things together, it's going to take a while. So stay tuned. We'll let you know, of course, when that comes out. But today's episode is Dr. Lisa. She's a hand surgeon, fellowship trained, and she has an organization called ChicksWithMDs. And it's like an advocacy group for patients and for doctors. So doctors can communicate better with the patients and the patients can understand what the doctors are actually trying to say, because she got a condition that isn't curable and it's a long-term process. And she was seeing all these pitfalls and the dysfunctions as a patient and just was like, I'm a doctor. This shouldn't be this difficult, right? So now she's got programs where she'll go around and talk about these things and, you know, as well as like contract negotiations and for the doctors, as well as patients understanding what they're getting with their insurance, where you can find the pitfalls. Plus, we actually talk about race relations and, you know, from where she was raised versus like the South and people of color. And we don't really get political with it. It's just sort of her life experience, what she's seen, and the changes that have occurred and definitely occurring now presently. So this is a really good episode. Even at the end, she's got amazing tips for relationships because her and her husband had to live apart for a while she was doing doctor stuff, and then they came together. And anyway, it's just a good episode. I'm really excited that the final China episode is this one. We did have I wanted to do 150, so like 2 more episodes, but one guy is catching conflicts. The other one, we just couldn't get it on the same page before I decided to stop recording episodes. So it is what it is. We're going to take a break. It's been 3 years, like we said before in a previous episode or 2. So super excited to spend time with the family and just relax a little bit and pick this podcast back up after a little break. So enjoy Dr. Bradley and I's conversation. Show notes are at doctorsperspective.net/148. Let's go. # behind the curtain. Live from China and Chicago. Today on the podcast, we have a great guest. But before I introduce you, I just want you to know today is the last time I will say live from China because I am moving on. So this is a very special episode. And let's just jump right in. It's going to be a board-certified plastic and reconstructive surgeon with a fellowship in hand surgery. She has a whole platform called ChicksWithMDs, which is partially the reason why we had her on, because I was like, wow, that's pretty cool. But it's a professional think tank to ensure continued care, educational empowerment of patients. And she's going to lecture on lots of different topics like private practice building, contract negotiations, disability and malpractice coverage. I'm sure that's the best hour. And helping students get into med school residencies and the all-encompassing work-life balance that we always ask about at the end of our show. So please welcome Dr. Lisa Whitty Bradley.
Thank you. Thanks, Dr. Justin. I'm so happy to be here. This is like the ultimate nerd experience for me because I've been binging your podcast and I really love your vibe. And I'm just so honored to be, to participate in one of these podcasts because I think your platform is awesome. And thank you for being approachable and funny and engaging and just things that we really need in the healthcare arena right now.
Well, I really do appreciate that. We always got to jump in. Of all the things that you could have done in life, you chose medical doctor, then you chose plastics, and then hands. I think plastics, I think a lot of people just kind of go straight to face, maybe breasts, stuff like that. And then you chose hands. And I was daydreaming about that the other day about There's foot doctors, there's teeth doctors. Why is there no special just handology?
Oh yeah,
There's
trust
not
me.
just a doctor.
There's a whole hand specialty out there, and we really come to light around snow blowing season when people decide they want to put their hands in the snow blower, and then also farm harvesting when they put their hands in the auger. Yeah. So, but yeah, there's a whole aspect of plastic surgery that is just dedicated to hand surgery. And that's just a little bit of what I do. Most of the time, what I do is breast reconstruction associated with breast cancer. And we just got finished. October was Breast Cancer Awareness Month. So we had an entire campaign on that. So anybody out there listening, if you have boobs, get them checked out. Make sure you're doing your exams. There's a whole, the spectrum of plastic surgery is something that unfortunately most medical doctors don't get exposure to, let alone the entire, just healthcare community. But we don't just do boobs and butts, although that's what's on TV all the time. Yeah, and it's the best field in healthcare. But I have no bias in that regard.
Of course. I remember as a chiropractor, we don't see a lot of certain things. And this one lady had come in one time and she had to have them both mastectomies. And I don't know, I guess her insurance didn't pay to get them reconstructed very well. So she just had like scars and was like, very just self-conscious about the whole thing and had pain and all this kind of stuff. So I was like, man, come on, insurance companies. That should be step 1, remove it. Step 2, fix it.
Yeah, actually, it's federally mandated that not only does your insurer have to cover breast reconstruction following mastectomies or lumpectomies, but they also have to cover the opposite side, the contralateral breast, to make them symmetric. So thank goodness we have that. But that's why we have to stay engaged and aware of what's going on from the legislative aspect of healthcare, because, there's a lot of things in terms of rollback of patients' rights. So we have to stay on top of it because they will remove some of those protections if we allow them.
So I have the same issue like everybody else.
Absolutely.
You want to do one thing and then they try to cut costs somehow, and then patients don't even get the things that they need.
Absolutely. And the other thing is that people aren't aware. So we have to make sure they're aware. Otherwise, they won't even access those rights that they do have.
Because I think, again, when I think, plastic surgery, a lot of times you think, like you said, TV shows. But in reality, you get your hand chopped. You want somebody to not only fix it, but make it presentable too if they can.
Right.
That's that's 2 skills right there. The ER can fix you, but somebody else has to make it pretty, I would think.
Well, yeah, you really want to restore function. And when you restore function and you keep those principles in mind, then you'll perform well from a surgical standpoint. So there are a lot of hand surgeons out there. So there's 3 tracks that you can pursue in order to do hand surgery. You can do orthopedics. And then do a hand fellowship. You can do plastic surgery and then do a hand fellowship. And there are a small percentage of hand surgeons that are just trained in general surgery. So those are the 3 major tracks to pursue for hand surgery. But yeah, and those guys in orthopedics and general surgery, they do just as good of a job. We all have those same principles in mind, though, of restoring function and making sure that we're preserving exceptional surgical technique.
Yeah, I was about to say, regardless of how you get there, the fellowship is the fellowship when you're focusing on the hand. And so it's all goes back to what you're doing.
Yes.
Okay. So that's fun. I enjoy listening and learning about all these things. But a big passion of yours is this Chicks with MDs. I love it because you're a double minority.
Yes.
Not white and a woman. So that's two wild things out there in the MD world. And we can definitely talk about that because you have when you're talking about students and everything like that, I'm pretty sure that's a roadblock for some people. And, you've been doing it for a while. So to me, if you want to talk about that later on or at some point, if it's part of your journey.
Oh, it's absolutely part of my journey. And, the good thing for me is that I grew up in Brooklyn. And I'm not sure what it's like being a child in Brooklyn right now. But growing up in the 80s, you had to learn, there was always you defending yourself against the world. And so for me, I always focused on what my strengths were and what I brought to the table. And that's just kind of how I pursued medicine as well. And the other thing is that I was surrounded in my family by people who pursued things whether or not they were allowed or not. They just did it out of survival. Ooh. And so that was always, there were a lot of entrepreneurs in my family, or there are a lot of entrepreneurs in my family. So it was never like, oh, I don't know if I can do that, because everybody was surviving and thriving, whether or not the larger society said we were supposed to or not. And so that's how I pursued medicine. And so when I decided I wanted to do surgery, and it was like, well, there's not a lot of women, there's not a lot of people of color. Well, that's just too bad. Here I am anyway. And so that's just kind of how I engage the world. So, and you really have to have that. And you know how it is. I mean, you're living in Asia right now, right? So, I mean, you're doing things that aren't necessarily typical of life, and you just have to pursue them. And there's always going to be noise outside that says you shouldn't, you can't, you won't, it's not possible. You just have to pursue it. There's a whole lot of people succeeding in the world right now who didn't exist 2 decades ago. They're the entity of what's the guy? I'm blanking on his name, from Amazon right now. That guy,
Bezos.
Yeah, Bezos, right? This guy didn't exist 2 decades ago. We didn't know who he was. There was no Amazon. And so, you have to think outside of the box. And that's how we have to pursue things, not just as women or people of color, but people who want to engage a larger audience, or even just if they're engaging their patients in their office. You have to be focused on being better than you were the day before. And so that's just kind of how I pursue things. And when you meet people who are minorities in whatever arena, they usually have that same type of focus. Like, okay, well, I couldn't before, but I'm doing this. I'm pursuing this. So, yeah. Is it hard? Yeah, for sure.
I mean, it's kind of a weird thing. Like, I'm the only white guy in town. So when I walk into like a wedding or a big function, I'm like, oh, okay, everyone's staring at me. And I'm like, is that what like the one black guy in an entire white church quote? Is that what it feels like? I was like, oh, this is weird. And that's just like all the time.
Yeah. Mm-hmm.
Would you say there's a difference between, say, people of color in like Brooklyn versus the South? I come from South Louisiana. Like, is there a different mentality there?
There is a different mentality because, and I say this because I've visited the South a number of times, and there is still the culture of the South. And, somebody from the South may disagree with me, but when I go down to Southern areas, there's still a culture of accepted segregation and accepted concepts of inferiority and superiority. And that it's been generations and centuries of inbred thoughts of that. It's not fact, it's cultural acceptance of those things. And so there are some people, and it's changing down there because you're having a migration from the North to the South. So you have people of color who have never lived under that structure. Right? They're from New York. They're from LA. They're from all of these people who didn't live in that environment. So when they go down to the South, they rebel. Those are the first type of people who are changing that dynamic. The other people that are changing it are the new generation who have been exposed to freedom on a variety of levels: social media, going to university, engaging other people. And so they're bringing a new culture into the South. And that's a big reason why you're having this dynamic in the White House and why you're having this cultural war, because the United States is changing. And it's changing because now people of color and immigrants and all of these people are getting more pieces of the American pie. And that is very frightening to people who have been raised for generations to think that they are superior simply because of their birthright and not because of what they're doing to improve their communities or to strengthen the bond between their family members. So yes, there's definitely a difference, but it is changing. But there are still some, smaller communities in, rural, wherever, where they hold on tight to those beliefs because that's really all they have left, because a lot of these people haven't ventured out. They haven't ventured out and tried to figure out, how do I improve just my nuclear family? And so, and they hold on to these beliefs that they have. And the last structure that's breaking that down is that they have people, usually younger folks within their own families, who are bucking against those beliefs from generations. So it'll get better, but it's taken some time. But yeah, I definitely noticed the difference between the North and the South.
Well, there's definitely, you could say, the younger kids. I mean, I consider myself still young, but not really. Mm-hmm. But you got social media, obviously showing you like, hey, these are some strong people of color that you could be that too. And you might be in a small town, but you could become this. And then,
yes.
I mean, face it, I know people that have never left Louisiana or never left their little 50-mile, 100-mile radius their entire life. Yeah. And that blows me away. I'm like, how? What? You've never wanted to go to the beach? You got to go out of the state to see a beach.
Yeah, right. Yeah, and that's really what confines people, is that if you want, and it's the same thing out here in Chicago. I'm in Chicago now. There are people who have literally never left the South Side of Chicago. They don't go downtown. People who visit from other countries have been down to the Magnificent Mile, and they haven't been down there. And when for years, we were legally segregated, and now people are just voluntarily segregating themselves. And that limits you. It stifles your growth, and it allows you to just fester in your own little pot of funk and hate. And so, we've got some work to do. But yeah, you're absolutely right. These small towns, they can just, live and breathe that same existence because they never venture out.
I mean, we'll get off of this in one second. Even like a school, like in a high school, if you had an older brother and stuff like that, sometimes they judge you based on what your older sibling did. You're like, I'm not that person. Like, I'm not. Can we get a clean slate here?
Right. And sometimes you're bullied by that older sibling or by that, hateful person in your family, just like they're doing to everybody else.
Let's bridge into. We mentioned it before. The Chicks with MDs. Give us a little taste of what's that all about. What's the mission? And in the beginning of the show, when I introduced you have lots of different topics that you can talk about. Like contract negotiations, to me, is really, that's important. And if you don't know about that stuff, man, the hospital will take advantage of you.
Absolutely. So just to give you a brief background for me of how the Chicks with MDs came to be, I was in private practice in Central Illinois for about 4.5 years. And my husband and I had a young baby, and we were living apart. So I moved to Chicago so that we could live as a unit. And when I got here, like literally within a month of me getting here and starting, contract negotiations with hospitals and getting a private practice loan and all this stuff, I was diagnosed with MS. And that kind of, everything came to a crashing halt. I had to figure out how to evolve as a physician and a healthcare provider and a parent and a spouse and a community member with this new diagnosis, because I couldn't work the way I was previously. I was working myself literally to death. And I created Chicks with MDs because I still wanted to serve the medical community. I still wanted to get out and work at whatever capacity I could. And most importantly, because going through this process of becoming a patient, I started identifying things that were detrimental to patients, that were detrimental to physicians and other docs and administrators and people who were trying to engage the healthcare community. And most importantly, I realized that there was a significant divide between what physicians were trying to get across to patients and what patients were interpreting or receiving. So I wanted to try and bridge that divide. And I thought that I was in a very unique position because I had been a physician for so long, and now I was a patient. And I wanted to relay things to people that I found were absent in my experience as a patient, and the frustrations that I had dealing with my healthcare insurer and getting my health insurance getting dropped by the medical center, and then me getting a surprise bill for $26,000 in the mail. And how do you deal with that? And who is your support? And so that's where that all came from. And when I started thinking about what should I call this entity that I have, and I thought about like who I was and the fact that I didn't want to separate and make this like some corporate entity, but that I wanted to make it engaging, and I wanted people to see it and immediately be interested in what I might have to say. Didn't like what I called it, or because they did like what I called it, or because the logo engaged them, or whatever. And so that's where Chicks with MDs, the title came from. And then the logo kind of evolved from there. But it really is my personality. Like, this is just who I talk a lot. I like to go out and ask people questions and get people to say things that I may or may not like and answer questions. But most importantly, inform and educate and empower folks. And I feel like I've been able to do that. And every year, the platform evolves and I do a little bit more, do things differently. But I've found that people are utilizing the information that I have. And I feel like I need to do more and more and more, because like you had a post, one of your podcasts was talking about chiropractic health, and that when people have health insurance, how their hospital stays go down and how they perform and how they recover is improved. Those things are essential. And also you talked about that we're like number one in healthcare cost. But we're like 50th in terms of performance. Yikes, right? So that's what we're trying to work on. Like, how do we improve people's outcome, and how do we improve their quality of life, which is so essential, because we shouldn't just be treating a disease. We should be focusing on how to make people's existence better on a day-to-day by treating their illnesses, but not just focusing on, like something that is a pet peeve of mine is when like students or residents or whoever presents on rounds, and it's like, this is we have appendicitis. Like, we don't have an appendicitis. We have a human being, like first and last name.
This is Bob.
Yeah. Like, before this person with appendicitis came in, they were a nurse, a doctor, a teacher, an accountant, the maintenance guy here at the hospital. They have.
He's at a major presentation in the morning.
Yeah, like, come on, give me a break. Because when you start to, when you don't, when the patient loses their humanity in your regard, that changes how you treat that patient. So you have to focus on folks and remember who they are, and remember, keep in mind who these people are before they come in the door and present with this acute illness. And that will change how you treat patients. And it should change how you treat patients. So that's kind of Chicks with MDs.
That's wild, because, MS is not something that is easily taken care of. Like you said, there's lots of visits that go along with that, and many doctors typically, and lots of different avenues between diet and medicines and finding a balance. So what an eye-opening experience to really have it flipped on your head, where you're the patient and it's not an easy diagnosis. It's not just, let's just cut out your appendix and you'll be better.
Right. And then get back to work in 2 weeks. Right. Yeah. No.
Right. That's a big hurdle to have to jump. You were mentioning the stat. I want to say America, in the developed countries, we're not so great at even keeping mothers alive.
No. No. Maternal mortality roof. Yeah.
Yeah, you don't think about it, but apparently it's a thing, and it's a thing that we should not be boasting about in America. I can't believe that.
That's actually the next campaign I'm working on, is maternal mortality. So stay tuned for that. Yeah. Mm-hmm. Yep.
Okay. I wasn't sure what, when you look at your social media and you're looking at things, and I wasn't completely sure what Chicks with MDs did. I wasn't more if it was like an advocacy group, or if it was more like a, ladies, let's get together. A lot of ladies like to, you'll always bind together and you become out stronger. And all of a sudden the guys are like, I want to be a part of something like that. And you're like, wait, that's like every other organization. You're like, oh yeah, okay.
Right. Correct.
Yes. So are you, or I guess, how are you getting your message? Are you having to market to different major medical associations in different states, or do people find, how does that work?
Well, it's been a blessing because people, because I do a variety of different articles, and because of my posts, people find me, like you found me. I was like,
yeah.
How did he find me? And so I'm just on social media. So I'm on like Twitter, Instagram, LinkedIn, Facebook. I have a website. And one way or another, people find me. And I think it's because there is a critical need for this type of information, and there aren't enough platforms that are really addressing it. Mm-mm. And the platforms that are addressing it exceptionally, a lot of times they're not on social media. So a lot of times and this is that cluster of, women coming together. A lot of times social media folks will come together and do things to just try and get the word out. So like if you're okay with me doing it, after we get done with this, I would like to share a link on my platform so that people know about you. Because I was like going through your posts and I was like, this is awesome. Like, how come Dr. Justin isn't all over the place? I mean, like you have all your, what do you call your chiropractic moments? What do you call it? It has like a catchy term that you know what I'm talking about.
See, I'd have to look it up. I think you're looking at my clinic site that I really don't play with a lot, but I was playing with it for a long time, and I kind of paused.
Right, but all of those things are very engaging, and people love that type of information. The other thing I liked about like your podcast is that they're short. And so it's just like a quick blip of information. So, because people's attention span is like not there. Like for me, my attention span's not there. So I've started to do very short video clips because I'm like, I know I'm not the only one with a short attention span, but I want to give people a lot of information in a very short amount of time. And I think that's critical to just know how people are communicating nowadays and make sure that we get the information out in a format that is appealing to them where they get the most out of it.
You see, I can appreciate that because in the marketing of like the podcast, marketing of, a lot of those blog posts that you're liking, this red book over here, I turned it into a book. So it's not like a brand new information. It's called repackaging. But that's smart. But, you listen to gurus and they're like, sometimes you need 3 to 5 minutes. If it's this kind of post on this website, you need like 7 to 9 minutes. And I'm like, I don't have enough time in the day to be watching 7-minute videos of anybody. Like, it better be a really good, funny YouTube clip or something for me to like stick around.
Right.
And internets are so crazy. Mm-hmm. Sometimes you get good internet, and other times you're like, I can barely buffer through a minute. And so to be able to have that variety, and I think we attract who we like, or people who like us. I want quick videos. Well, you get quick videos,
right?
And then you have blog posts. If you want to read, you can read and just kind of go down that rabbit hole, and you attract who you want to attract. So, okay, I think this is a fun question. Are there any misconceptions about what you're doing? And is there you've kind of given a couple takeaways, but whether it's the patient advocacy part or the doctor advocacy for the patient, kind of keeping those in mind, any major takeaways that we should have just from listening to this episode?
The misconceptions aren't associated with Chicks with MDs. Like I would say, like at the beginning, I did like a women's wellness, some type of expo, and a man. I had all day. It was a women's expo. And so like all of these women all day were like, oh my God, this sounds awesome. Y'all want to sign up for the email, all this. And at the end of the day, this older guy came up and he was like, don't you think that women would be insulted that you have this entity called Chicks with MDs? And I was like, no. And no, but you're the only one all day. And he's really the only one who has ever relayed that he was insulted by the name. The only issues that people, in terms of misconceptions, is really about plastic surgery and plastic surgeons, because most of the time when people approach me, or when they find out that I'm a plastic surgeon, it's like, oh, boobs, or oh, butts. And that is like, for the average plastic surgeon that goes to work every day and sees patients, boobs and butts, they're thrown in there. But the majority of people are coming to you because they either have hand surgery complaints, or they have skin cancer, or sometimes you're fixing a baby's cleft lip and palate, or a large percentage of plastic surgeons out there are doing breast reductions, breast reconstruction for cancer. We're doing, what we call bread and butter stuff. And so it's not that we don't enjoy doing boobs and butts, but that's really not what comprises plastic surgery. So if I could talk about misconceptions, it's really about how people perceive plastic surgeons. And this is another reason why I like using social media, because it gives the international community another side, another view of what plastic surgeons are, that we do advocate for our patients all day, every day, that we go to multidisciplinary breast conferences every month, every week, to advocate for our patients, that this is how we need to approach doing breast reconstruction. Who's a good candidate? Who isn't a good candidate? And so, and we take that back to our offices and share that with our patients. And we are constantly in a quest to relay better care. So if there's the misconception is really about plastic surgeons and how we're perceived, and that we're basically like the lawyers of the medical community. And my bad if any lawyers are offended by that. But that's kind of, how lawyers are perceived as ambulance chasers. It's like, people think that we wear trench coats and then we walk into like strip clubs handing out our business cards. And God love them, they need care too, right? But those ladies need care too. But we do a lot more in terms of trying to advocate for folks. And then what was the other part you wanted me to address? Was it the platform?
Oh, it was, and I think, like I said, I think you probably answered this part already. If someone was listening to this and they're like, what's one or two ways that like patient advocacy and then doctors knowing about, make sure they address the patients correctly.
Right. So patient advocacy is can be very tricky, because you want to make sure that you are educating folks, and that you're making sure that they have access to adequate resources, which sometimes may not be you, right? Sometimes when a patient comes to see us, sometimes they don't need a breast reduction, or sometimes that's not the first step. Sometimes it's, are you wearing the correct bra? Do you have chronic back issues? Have you had a back injury and that's resulting in your symptoms? Because if you've had big boobs for 20 years and you just started having back pain 18 months ago after a motor vehicle accident, that might be your problem. You know what I mean?
Yeah.
Rather than saying, you know what, these big boobs, sometimes we have to look at, once again, this is looking at the patient comprehensively. Globally, like what's going on, what has changed, and if nothing hasn't, if we haven't addressed some things, like can we work on back strengthening, exercises, what have we done to try and improve your quality of life before we go to surgery?
So typically, this isn't like a 250-pound woman or something like this. It's kind of like a fit woman with ease or whatever, and like my back hurts.
Well, and what sometimes it can be an obese woman. But once again, you have to look at somebody globally, because if you're obese and you've been obese for a while and you've had big boobs for a while, and then you start having back pain out of the blue, we need to address that, versus I've had big boobs for 20 years, I've had back pain for 20 years, and I've just tolerated it. That's something that you get from a history, and that's something that we hone and revise and build on over our practice lifetime. But you have to, being a great doctor is not just about, cutting somebody or knowing how to manipulate somebody's spine effectively. It's also about how do we get people to tell us what we need to know. You know what I mean? Like, What is it that, you learn these skills over time? How do I hone this information and get these nuggets of gold so that I can effectively take care of the patient, not just so I can, charge for whatever procedure. And that's what the majority of people are trying to do when they're caring for patients is how do I get the appropriate information so I can make the right diagnosis and treatment plan for you?
Because it's hard to pull some of this information out.
Yeah, it is. It is. But, but that is major advocacy, is when you're looking to make sure that the patient is taken care of, not necessarily so that, you're getting your case logs, that you're getting you're here for a breast reduction. Okay, we're getting you scheduled for a breast reduction.
That's what you want. I'm going to give it to you.
Yeah.
It's not my job to convince you not to have it.
Right. Sometimes advocacy is saying, okay, well, you came here for this, but you've got a suspicious lesion here on your hand since we've been talking. How long has that been there? Or,
well, I'm not worried about that.
Right. And sometimes it's going through somebody's history and saying, the symptoms that you're describing can also be associated with your history of X, Y, and Z. So that's also advocacy. And then advocacy is also on a larger platform of let's also do Breast Cancer Awareness Month. Let's also make sure that people are not going to seedy hotel rooms to get silicone injections into their butts. So all of that is advocacy. But so it comes in different forms. And the other thing is that you can advocate every day on some level. Sometimes it's me advocating for other physicians. And I know that people are like, physicians don't need any further advocacy. But when you when you
can't do the job you want to do.
but when you talk to people and you figure out, like for me, when I got diagnosed and I started reviewing all of my contracts, my disability contract, my malpractice contract, my health insurance contracts, I started talking to other docs like, hey, do you know what kind of disability insurance you have? Do you have disability insurance? And that's really how I got on the track of not just advocating for patients, but also advocating for physicians. And who else is going to advocate for physicians but another physician? Because I've gone through all of these plot twists and, had the floor fall out from under me. And I wanted to try and help other docs so that they were not in the same predicament that I was in, or in some of the things that I actually did do well. I wanted to make sure that they had that information as well. So that's all advocacy though. And, we don't have to, like advocacy, once again, is not just getting a bullhorn, and doing a Bernie Sanders. You know what I mean? It's sometimes it's just having a conversation with somebody like, hey, I went through this experience that was very traumatizing, and I want to make sure if I can prevent you from going through that, I want to. That's advocacy. All of that is advocacy.
I remember doing disability insurance and realizing 90 days. It's like, my goodness, you can go bankrupt in 90 days.
Yeah, exactly. That's right. And some disability policies are 180 days.
That's a long time to not be able to practice.
Are you kidding me right now? That's 6 months. So you have to, make sure that people are prepared. Like, do you have an emergency fund? And, there's a lot of people, no matter what they're making every month, they're living paycheck to paycheck.
Yeah.
That's right.
I bet you in Chicago, you could probably it's not hard to probably find a multi-million-dollar condo and live the good life.
Yeah, and spend and be house poor or condo poor.
Mm-hmm.
Yeah.
Mm-hmm. Yeah. There's a lot of surgeries you got to do there.
You better advocate all day long, my friend.
Man, we better have a snow season. We used to joke as chiropractors. I was in Colorado. I'd mess up with my assistant, like, man, I don't want them to slip in my house, in my neighborhood area, but if they want to slip at their house, man, that's some really good back patients right there. Just a minor sprain. We don't want big surgery. Nothing serious. Just come in a couple times. Come on, we get some ice. No, it's just joking though. Doctors can joke. Come on.
I know. And you know what though? It becomes morbid. Like we got to stop hanging around each other. Yeah.
That's right. Agging each other on. Come on. What you got? Well, I always like to respect people's time. I'm noticing the time. And one of the things, boy, there's so much to talk about. I'm going to skip 5-year goals unless you really would like to talk about those.
What are my 5-year goals?
Yeah, we could either talk about that or we could jump to the more personal side of the interview. Which would you prefer?
Well, how about I give you like a minute of 5-year goals and then we can go on to the next one? Okay.
Let's do it.
So for me, another great thing that came out of all of this chaos is that I started writing fiction. And so one of my 5-year goals is to publish a book or a short, a full length or a short story book every year for the next 5 years. So I've done my first book of fiction, which is under Stella Jones is my pseudonym. And I published that in 2018. And I have a book of short stories coming out at the end of this year. And so I'm going to do that. That's one of the things. The other thing is that this last year I've spent going back into clinical medicine. I've been very fortunate to be able to find part-time. You'd be surprised how hard it is that when you have a disability as a physician, that it's very hard to, number one, get on staff because they think, you're Humpty Dumpty, that you're going to like fall, yeah. They're going to be responsible. But then also just being able to mold a practice where you take care of your health. Because you know how it is in healthcare. It's like you could work yourself to death and then they'll just like post a for lease sign in front of your office space. You know what I mean? So yeah. So it's been great in that regard that I've been able to find a clinical practice where I can work and take care of patients. So I'm building up that. But then I also want to find a way to go back out there kind of on the road and do lectures, because I really feel like there's a great impact when you can go and engage people and talk to them and not only provide information like in a lecture, but you really gain a lot in terms of being able to relay information when you have like the question and answer, or you have a round table afterwards, and be able to engage people, because then they can take that back into the community and share that with other folks. Like, make sure you're getting your mammograms, make sure these are the options you have. And then the same thing when I talk to physicians, that they can go back out and carry that information about contract negotiations, disability, malpractice, et cetera. Okay, those are my 5-year goals.
Is any of this stuff CE for the medical doctors, or this is all just sort of things you should know?
The CME, you mean, like the continuous medical education? When I work, like sometimes I go out and I contract to work for other companies, and usually when I do those lectures, those are CME affiliated, so that they're already at a course where they're getting CME. But when I go out independently, it's just me. And most of the time when I go out independently, I talk at a variety of places like churches. Sometimes I go and I give grand rounds presentations at other universities. And then, so if I give a grand rounds, that is CME, right? But like if I go to a church, or if I'm talking at a women's group or something, no.
Right.
But there are a lot, I would say probably it's like 50-50 that whether they do get credits. But if I do it independently, no. But if I go and talk like with the university or whatever, it is.
And congratulate, because I think this is one of the things about the medical profession. We can just work 2 or 3 days a week. A fit quote working. When we say work, we think we're dealing with patients. And then anything else is like a side job or something like that. You know what I mean? But for real, like that's like 2 full-time jobs for you. Like I do this to keep my skills up and I enjoy it and I love it. And then I have this passion project that I really want to make bigger. And that takes probably, like you said, more weekend type of stuff, like a Friday or a Sunday or something like that to, travel more. Yeah,
it starts to it becomes like a melting pot. Like eventually it all starts to infuse. One starts to infuse into the other, where it's like, I don't know, maybe vegetable soup, or I'm not sure, maybe ice cream, 2 flavors of ice cream melded together, but they wind up influencing each other.
Yeah.
And that also makes you approachable from a patient perspective. When they know that you do other things, like medicine, unfortunately, the perception is that it's very sterile. And so you tell people, oh, I also write fiction, or oh yeah, I'm on social media. You can find, it's like, what? You're like, you have
it's weird.
So it allows you to engage folks. And it also, it drops the wall, because there's a perception that you're not approachable, or I shouldn't talk to you about other things that I may find interesting or intriguing or whatever. And when people drop their guard, they're more likely to relay information that maybe they thought you would judge them or whatever. So there's been no drawback for me for engaging on social media.
I did a African-American series, man, I guess 2 Christmases ago, kind of like the whole holiday series. All those ladies, they end up all being all ladies for some reason. And between now and then, it has been great to follow them. They're releasing books and workshops and programs and all these different projects. And I'm just like, wow. I caught them before they did that stuff. Yeah. And they were already looked like a shining light to me. Yeah. So it's really cool to just see these people just come up and have the social media presence, and they have their own following, and they're just doing it.
And, the thing is that social media allows people to pursue all of these entrepreneurial goals that, sometimes we just kind of keep to ourselves, or what people do in their basements where nobody else is watching. Yeah. And you get inspired and motivated when you see other people out there doing it. Like, oh my goodness,
I could be doing that.
I've got a book. I can't even tell you how many people send me DMs and all this, like, hey, would you read this paragraph? Like, yeah, send it to me. People have all of these dreams and ideas, and sometimes you get older and what you learn from your family or from society is that, oh, that's kid stuff, or those are passions. That's not your life. It's like, whoa, you're supposed
I can make it both, please.
Yeah, I'll take a helping of both of those things, please. You should be able to mix them. And when you're pursuing your passion, for me anyway, it's not work.
Right.
It's just that doesn't mean it's not hard, but it's not a chore. You know what I mean? It's like, these are things that motivate me, that inspire me. And I think that there's a misconception like, oh, well, if you're following your passion, you're just playing around. You're not working.
Please, I'm sure you can spend 14 hours in one day doing all the stuff that you're doing and just be like, man, I still have another 20 hours to do, but I need to go to bed. And I'm just fired up to continue. Yeah, you got your husband and your kid. Hey, can we have some of your time?
Right. Yeah. Well, I actually have insomnia, so I do most of my writing.
Even
in the middle
better.
Of the night. Who needs
I can't sleep. I'm gonna just do something.
Yeah. So it's been great. It's been a journey.
I got a 1-year-old. It feels like I have insomnia. It's like, would you just stay asleep? Stop reversing.
Congratulations.
Thanks.
I remember those
cutest little
days.
Asian Cajun you can imagine. Mixed babies. Whoop, whoop.
Oh, that is so sweet. Yeah, I remember those days for a 1-year-old. All energy.
It's fun though. I'm a young mid-30. But let's do this. Okay. So you got a husband. I'm sure he works.
Yeah.
You got a kid. You got your own stuff that you do a lot for. Now, it sounds like you do travel for that, so that might be considered vacation for you. But a lot of docs in general just don't take enough vacation. We don't use what we get or given. What can we do about that? How can we maximize our vacation that we're given?
Okay, so you got to get them young. Okay, and that's a reason why I try to engage with medical students and undergraduate students and high school students and residents and fellows and everybody to try and tell them early, like, taking care of yourself and attending to those things that are most important to you is not a sign of weakness. Okay, I did 9 years of postgraduate surgical training, which is way too much for anybody for 5 lifetimes. And the thing that was always stressed, and not verbally, but just in actions, was that, sleep and eating and taking time for family and attending things that bring you joy is a sign of weakness. You carry that, and they teach you that. You get indoctrinated in medical school very early that these are signs of weakness, doing things that you love and enjoy, and these are things that are strength, and that's dedicating all your time to the hospital, which would bury you in the backyard and put a for sale sign over your tombstone. So now, are things changing? Yes, because the newer generation of people are very self-focused. Okay.
Yeah, I ain't working 60 hours a week for what?
So things are changing, right? But there's still a lot of unhealthy lifestyle practices in medicine and in just in the general population. But for me, I know medicine, so I try and teach people or show people hey, first of all, you can make a decision very early on that you want to make max profit, or that you don't like the people in your family, or you don't like your spouse, so you want to be at work all the time. But those are choices. And you can also choose to work 75%, 50%, or that you have, there are certain practices that I've been affiliated with some of these physicians where every 3 months they have to take 2 weeks off. That's in their contract. So you don't have to go on vacation, but you can't come here. So it's structured into their practice. They work 3 months and then they're off 2 weeks, or they're off 4 weeks, or whatever it is. And so it's basically you don't, and you can go somewhere else and work for that time, but you're not going to be here. So they kind of learn that this is part of your practice. Part of your practice is taking time off. But also what's important is, especially for the younger folks, is making sure that you don't forget about people. Don't, go into medical school and residency and beyond, and then not go to anybody's wedding. Forget about people having babies. Forget about those things for yourself. You have to structure time. It's just for me, I have and my husband hates it because I have calendars all over the place. This is what I do on this day. But there is, when is my yoga time? For me, for my health, yoga has been life changing. And so that's a part of me. And so because I do yoga so much, now everybody's doing yoga. The dog does yoga, or at least she comes and sits on the yoga mat. But, everybody's doing yoga. The kid, my daughter does yoga. My husband does yoga. My husband just did a marathon. And what did he do before he started? He did his sun salutations.
Come on.
So, I mean, and it's and
we laugh until we do it and enjoy it.
Yeah. And he didn't even say, hey, come and do this with me while I'm here. No, he just got up. We went down there with him so he could get started on the marathon. That's part of his routine. So, but you have to be intentional about taking care of yourself. And so that's just what I try and impart. And if I could say one last thing about this work-life balance, there is no work-life balance.
True.
Somebody is going to sacrifice. And you have to decide where the sacrifice is going to be, because there's only 24 hours in a day. So you're not going to appease all of the gods. Somebody's going to have to take a little less. And my hope is that people decide that their self-care and spending time with their family and friends and going to great events and taking vacations, that they sacrifice more to enjoy those things rather than saying, okay, I'm going to sacrifice all of that and spend more time at work. My hope is that when they see me, or they see you, or they see whoever's out there doing something other than clinical, that they say, I can do this. It's possible for me to, cheat a little bit more for myself and self-care and less time. But there's no balance. Somebody's going to have to take a hit.
And usually there's seasons.
Yeah, for sure.
You might have a couple of weeks where you're look, I gotta bang this out for the next 2 weeks. Right. And then we'll have a break.
Yeah.
I tell people this sometimes. If you kind of have been in practice for a while and you kind of got an idea of how much money you could make, or you do, you know what I mean? You can project that out based on RVUs and all that. Talk to your spouse. If you're I got to work all the time and y'all fighting about you don't see your kids and all this, you need to have that conversation with your spouse. Hey, if we made X amount less money, I could do that. We could do that. I could take off this day or shut it down. That means we're going to lose this much income.
Right.
Are you cool with that? And if you're not cool with that, then it is what it is.
At the, you know, unfortunately, I have seen so many docs who make a whole lot of money and die. And then you're not taking that stuff with you. You know what I mean? You're working yourself into an early grave, or you're depressed, or you have a dependency on something to keep you going and active. Like,
Think about this. I chose to work in China for almost 5 years. I'm done now. Like 2 weeks. This is the 5th right now. And then I'm done on the 15th. I'll be back in America. January, I'm going to Cologne, Germany.
Mm-hmm.
So like, I'm going to go to work there for a year.
Mm-hmm.
And that's crazy for a lot of people. But I'm like, that's what my 30s are going to be. When I look back in my life, it's like, dude, that decade of my life, I was doing something that most people won't do. Working, traveling, enjoying it.
Mm-hmm.
And from then on, I guess I don't know what I'm going to do. But, it's just one of those things where you can change it. You can change the priorities of your life. I'm not saying you got to go work abroad, but you can take more time off and just realize that, hey, I'm still going to be okay financially, generally speaking. Because I think medical doctors versus other doctors, sometimes there's a difference in, y'all usually have higher salaries
mm-hmm.
versus like a dentist where there's not really a salary. Typically, it's you eat what you kill.
Mm-hmm. Well, it depends on, but dentists actually are in this healthcare arena are ahead of the game because of how they negotiated in terms of their reimbursement from insurers. But that's a whole nother topic. But and the other thing I want to say for anybody who is tuning in, who may be looking at things from a second career perspective, or, feeling like they're coming into this late in the game, is that even if you're, like when I started medical school, there was a guy who was a PhD who was starting medical school at age 50. My mom actually was an ICU nurse for 10 years. And then she and my father were married, and they had us. And then she had been discouraged from going to medical school in high school, and went back to undergrad. We would go to classes with her, and then she went to medical school, and et cetera, et cetera, et cetera. So for anybody who's tuning in, I don't want you to think that, it's too late in the game for you, or you can't still go and pursue things. And, like the world is literally, because you're halfway across the world, that the world is still out there and open for exploring and pursuing. And I hope that people take from our exchange that they can pursue whatever profession they want in whatever way that they see fit, that there is not one mold for pursuing medicine or pursuing their life's passions, and that may evolve over time. Because I can tell you right now, if I never got sick, you and I would never have had this conversation, because I would just be in clinical medicine. I would have never thought twice about that just being my life. But I'm very thankful that it evolved to this point where I am talking with you from halfway across the world, and that I think that in both of our ways, whatever we're pursuing this, that we're helping folks, that we're advocating for folks, and a different way of being and pursuing and practicing medicine.
I did a podiatrist a few months ago. Mm-hmm. She ended up having like a heart surgery and Marfan syndrome, and she had like 10 podiatry clinics and all this kind of stuff. She's like, yeah, that stopped.
Yeah.
You got you got to have a heart valve replacement or whatever it was. She's like, that'll change your priorities in life in a hurry. And she had her own, awakening and journey that she had to go on. And she went the, an allied health style of things. But last question. You ready for this one?
Yes.
In this show, we're kind of talking about money. We're talking about these spouses. Divorce happens. Yes. It's a higher rate for doctors, which is never good. So how are you able to keep the love alive and feel connected?
Whew, boy, that's a hard one. Okay, so I think the first thing for me is communication. Okay, you have to be able, your spouse has to be comfortable telling you when you're not being nice or when you're not being available, and that you're open to those criticisms. I think as doctors, we're used to kind of, in some realms or some arenas, thinking that we're omnipotent or that we are in charge, and I think if you have honest communication in your household and with your spouse and with your children and your pets or whoever, you have to relinquish whatever concepts that you have of yourself. When you walk through the door of your home, you have to know that you're on an equal playing field, that you have to be available, open, engaging. Um, and the other thing is you have to find a partner who, is the yin to your yang, right? So for me, I love humor, and there, even if my husband and I may be warring with one another, there's always some type of humor, and I think that relaxes us both. Like we can needle each other and still, and that be, reaffirming of our bond, and that for us it was important that we were friends first, because you're going to go through so many tumultuous things in your relationship. Like my husband and I have been together for 23 years, but we've been married for 11, right? Because we weren't going to be married while I was in training and all of that jazz. And so, I mean, as you can imagine, I mean, we've gone through a life period, like a life cycle, 2 life cycles. And so you have to be able to engage people outside of being attracted to them or them being, a breadwinner or you being a breadwinner. There's got to be something, that where you communicate on a level and an understanding that other people just don't have. Because when you have trying times, that's what's going to preserve your bond. And there are going to be times, when I want to hit him over the head with a ruler and he wants to do the same to me. And so you have to find, you have to, you have to be patient. And you also have to accept that those times will come and learn how to communicate even through those rough times. Because when we first started dating, I mean, it was like if we had an argument, it was like the entire situation just shut down. We just wouldn't talk to each other for days. Like, how's this going to work? But we, figured out how to communicate, and it's like, how to express ourselves, how to take time to, and also realizing that when you're wrong, or even sometimes when you're not wrong. You want to salvage things. How do I communicate? How do I? And also making sure that sometimes even when your perception isn't that you're wrong, that sometimes you can still be wrong, even when you don't think you are. That's been very hard for me.
Delivery can be a massive issue too sometimes.
Yes.
I delivered some truth, but it was a bad delivery.
Yeah. Like, why? And my husband told me that the other day, like, listen to yourself. It's like, I am listening to myself. I'm correct.
I sound great and in charge.
Like, hello? Like, and just because you are factually correct, sometimes your words can be piercing, especially for me, because I'm like the queen of sarcasm. And my comfort zone is just throwing spears. Like, I can kill somebody with my words. So I have to be cognizant of that, sometimes I just have to not say anything, or I have to, what I've learned, I saw this on social media somewhere, is that sometimes if you want to say something, take 5 minutes or take a day. And if you still need to say those things, then say it. And 99% of the time, by the time the first minute is up, I know that I don't need to say it. Because some things, it's like, okay, if somebody's about to cross the street and a car's coming, you say whatever you have to say so that person doesn't get run over. But, other times, like if they say something that you don't like and you know that you could just come back with a verbal response that would just murder them, you just don't need to do it. You just, and that's also something that I had to retrain myself out of after training for 9 years, because, you're in a constant state of defending yourself when you're a resident or a fellow or a medical student, whether on rounds, because,
why'd you do this? Why'd you do that?
Right. And you're constantly like coming back with something, and that becomes your defensive. It becomes your way of being. And that way out in the world is not a good way to engage people.
Right.
So I had to relearn that. And I have to like take a deep breath. Like after I've been in the hospital for a while, it's a different culture. So when you come home, you can't be like bossing people around like, hey. No.
At work, you are the top dog. You know what I mean? You're in charge of everything.
Yeah.
I want the practice to run this way. I need the nurses to do this. It's all on me.
Or
I'm the surgeon.
Because if you're not assertive, sometimes things don't happen for your patients, and that can be detrimental to them. And so, but you can't take that back into the house. Like, hey, I told you to get a rice. Where is it? I mean, it's like, to take it down. So, for people in medicine, I think, you have to learn how to engage your spouse, not as, your subordinate or not even as your colleague, but this is your spouse. This is your life partner. And there's a difference in how you relate to them and to your children. The same thing. You're not a drill sergeant. You know what I mean? When you talk to your children, and they're not just little, miniature beings that are supposed to be just following your rule. You're also having...
They have their own personality. I'm learning. It's crazy.
Yeah. And
I don't want that.
Yeah. Right. Well, you wait till they're 7. I have a 7-year-old right now. Okay. And the other thing is that you're going to see parts of you in them. And it's like, hey, only I'm the top dog around here. The assertion doesn't come from you. It comes from me. Like you have to, you have to let your kids grow and be and evolve. And also they will tell you, you're not being nice, or you're not being fair, you're not being fair. It's like, oh, wait a minute now. Maybe I wasn't fair. Or, but that's another time where I have to step back and say, am I being fair or, am I disciplining? Like, is this appropriate or isn't this appropriate? So it's a journey, and if my husband was here, I'm sure he would peek his head in and she's still learning. You know what I mean? Like it's it's an evolving process. So yeah, it's I think, I don't know if that answers the question, but
definitely. I mean, you got to remember, I think for myself, sometimes I have to remember we're a team, especially when we're really just in a stressful situation. Like we're having to pack up our entire life into 4 suitcases. That's some stress. Is this coming or is this going? Right. Do you need it or do you just want it? And we have to stop back, every couple hours. It's when we're really packing day and we're just like, hey, we're on the same team. We're on the same team. Good. All right. And then, you just sort of give it a hug and you just kind of rebalance yourself and you kind of keep going. But if you don't, it's very easy, I would think, to just, like you said, spears. And what really, I mean, I've always learned I had an older brother and a younger brother. So I kind of learned how to
needle,
find what aggravates somebody and play with it. But, oh yeah. Well, let's have some websites. And do you know your handles for at least Instagram?
I know handles for everything. So I have. My website is www.ChicksWithMDs.com. My social media handles for Facebook, Instagram, and LinkedIn is ChicksWithMDs. And if you want to see my literary work, it's Stella Jones Paranormal Romance. But you can find all of my links and all of my social media handles on the website. There's a bar at the top on the landing page, and you can find out more than you ever wanted to know about me and my experiences on the website. Oh, also, if you, and I have all of my links to my books on the website as well. So I won't snore you with all of those links. But yeah, just go to the website, ChicksWithMDs.com, and you can follow me on social media. I would love to hear from you all. And thanks, Dr. Justin, for having me. This has been absolutely awesome.
Well, you've been a top-notch guest, and I just love all the information. I don't mind going long because sometimes you just got a lot to say, and it's good information. So very happy to have you on. Thank you so much. And hopefully people will be hitting you up on all the flavors that you've just mentioned.
Thank you.
Another great interview has ended. While you're on your phone, click that review button. Write up a nice review for me. 5 stars if you could. As everyone says in the industry, it'll help other people to find us when we have enough rankings Not to mention, I'll mention you and your review on an upcoming episode. If you follow me at all on Instagram, you know you only get one link. So I use a Linktree. And so it's a doctorsperspective.net/links with an S. And that's going to give you everything you need to know. The top episodes of 2017 and 2018, the podiatry series, dentist, acupuncture series, holiday 2017, financial series, how to write a review, how to support the show, like buying a cup of coffee, getting swag, like t-shirts, the Today's Choices, Tomorrow's Health book. That's the blueprints for better health, exercise, picking food correctly, and financial. And then, of course, bundle packs, which can get you the No Needle Acupuncture book for 40 common conditions, including the electric acupuncture pin at a great deal. The resources page has some of the products that I like. It's affiliate style, so if you buy something from them, I get a piece of that. Just like on the show notes pages, if you buy a book from clicking that link, I get a small piece of that as well. So I really appreciate that. Things like Screencast-O-Matic, Pure VPN, Missing Letter, JLab speakers, ProLone, Edge, or Hawk grips. Once again, if you do need any coaching on how to improve some of your blood work, drop weight, and the ProLone diet, fast mimicking diet, 5-day plan, let me know. As well as if you just need some coaching, whether it's health, whether it's marketing, whether you need some practice growth, etc. Reach out. Facebook, Justin Trosclair, MCC. Of course, at a doctorsperspective.net on the top right, you got all the social media icons that you can imagine. Click your favorite and reach out. Thank you so much for tuning in. Please tell a friend, pass it along. You can go to .net/listen. It's just that easy. It'll open up right in your app. And don't forget, I appreciate you. Listen, critically think, and integrate. See you on the mini-sodes on Thursdays and Saturdays. Hope you're enjoying those. I'm definitely having fun summarizing these podcasts in less than 10 minutes for you. You get the nuggets without having to waste your time. Have a great week. We just went #behind the curtain. I hope you will listen and integrate what some of these guests have said. By all means, please share it across your social media, write a review, and if you go to the show notes page, you can find all the references for today's guest. You've been listening to Dr. Justin Trosclair, giving you a doctor's perspective.